Ladies and gentlemen, welcome to MedSynapse podcast series, where we will be navigating through the medical student maze, where we will explore unique challenges faced by medical students and explore practical solutions to overcome them. Join us as we uncover the realities of medical education and provide valuable insights for aspiring and current medical students alike. On this important topic, I would like to introduce you our esteemed guest, Dr. Rahul Shabadi, who is a distinguished cardiac anesthesiologist with a wealth of experience garnered from prestigious institutions worldwide, including MC Master University, University of Miami, Nottingham University, Sultan Qaboos University, and Mumbai University. With a passion for mentoring and a keen understanding of the challenges faced by medical students and junior doctors, Dr. Shabadi is uniquely positioned to offer valuable guidance and support on navigating the complexities of medical profession. Join us on the MedSynapse podcast as Dr. Shabadi shares his insights with us today. Welcome, Dr. Rahul.
Thank you so much, Nigar. Thank you so much for organizing such a unique sort of podcast where I'm sure many medical students who are into medical schools, who are facing different kind of problems at medical schools during their journey into the medical school. So I'm sure they will get some benefit from our podcast. Thank you so much for organizing this. And thanks to MedSynapse.
Thank you so much for being here to raise awareness on a very crucial topic, which is not very widely spoken. And as an expert doctor, as a senior doctor, you are here to guide the young doctors.
Yeah, thank you so much. So, Nigar, actually, I started thinking about this problem when I was at Sultan Qaboos University and even before that, because I had been always working with young doctors into medical schools or into residencies, and I come across their professional journey and academic journey. And many times I have seen, even though that student is really bright, but because of many issues, they will start lagging behind and the pressure increases. And as you might be knowing, the dropout rates, the medical school dropout rates in USA is around like 15 to 19%, so which is quite high. So around 15 to 19% students who opt for medical school in US, they drop out and they have to find different kind of education. So that rate is high. So maybe in India and in Middle East, the dropout rate might not be that high, but still it's there. And when I was working with Sultan Qaboos University, I was involved in the intercalated course where these dropout students, we were mentoring and we were trying to give them the sort of courses so that they can take different courses and they can build up their careers. And that time I was thinking we should have some program to support these medical school students before they are really affected. And that's why I came up this idea. And then when I talked to you, you had been very kind to arrange the podcast. So thank you so much. We can go ahead.
Thank you, Dr. Shabadi. Your dedication to mentoring and guiding the young doctors is very commendable, and it serves as an inspiration to all of us.
Thank you so much. Thank you so much for your kind words.
Dr. Shabadi, to begin with, what are the common challenges for medical students in their first 2 years? Well, not only the first 2 years, but also during their clinical rotations. And how can they manage them to do well academically?
So, Nigar, I will first cover the problems faced by the medical student during the first year and maybe in the second year. So during the first year, the most important problems most of the medical students they face is the adjustment reaction, because different systems have different curriculum. In India, after their 10+2, they go to the medical school, the university level. As compared to the UK, they finish 11+2 and then they go to the medical schools. But as in US, they finish their bachelor's of science and they go to the medical school. But most of the time, what they face, the problems are the adjustment reaction in the first year of their medical school, because from the college, they go to the uni level. so university level. So the problem, what the start is the adjustment reaction, because they are most of the students, they are away from their family, they are away from their friends, and they are away from their support system. That's the first thing. And the second thing, the learning pattern completely changed, because during our college days we have limited books and whatever limited curriculum, and you are being tested against that limited curriculum. But in medicine, once you enter, it's endless. You know that how endless or how vast this anatomy, physiology, and even the biochemistry is in the first year itself. So your educational system completely changes. And then they struggle with the support system, they struggle with the mentoring. And these are the main problems what they mostly face during the first year of their medical school. The most important is the adjustment reaction. And now in colleges or like in the school, we have like basket of different kind of students. So you have like outperformers, you are good performers, then you have like average, and you have below average students. But once you enter into medical school, you have got all A plus students, right? Who have got grades of A plus, and they are all in the same basket. So they start facing high academic pressure. They have to prove. If they want to prove, they have to compete with very bright students, right? So in the college or in the school, you are competing with all the mixed basket. But once you are in the medical school, you are competing against very, very outstanding and bright students. So they start feeling that pressure to prove themselves and the competition. And apart from that, they have to get the good grades, the academic pressure. So these are the problems they start. And as we know, all of the medical students, they are really highly intelligent students, and they are hardworking and they are perfectionists. But at the same time, when these are good traits, they can be difficult too, because with this perfection and pleasing all the people, that kind of virtues, they will start facing some feeling of procrastination, and that is something noted or denominated as imposter syndrome. So that self-doubt, or whether I will be able to do it or not, keeps nagging in their heads, and they fall prey to this something called imposter syndrome. And as you know of, the medical schooling is not easy, because financially also the parents have to spend a lot of money in their medical school fees. So the students directly or indirectly start feeling that pressure, because a lot has been invested from the family in terms of their ambitions and what they feel or what they want their kids to be seen where. And then apart from that, the financial pressure. So those kind of things start building up. I'm sure you would have gone through all these kind of phases, Nigar, when you had been in your first and second year of your medical career. What do you think?
Dr. Shabadi, I definitely agree with you, especially that I have done my medical degree abroad, away from my family. It was double challenging for me, like not only being in the medical pathway, but also being away from my family, where I will have to be independent, I will have to be responsible, I will have to study and manage my own life. So it is the most emotional years of our lives as youngsters. I definitely agree.
Yeah, I do understand. Yeah.
Dr. Shabadi, how can medical students manage through these challenging years of medical school?
So yeah, Nigar, as we already mentioned, what are the major problems they can face apart from their personal issues? These are the major issues what they will face. I think for all the medical students who enter into their first and second year, they should definitely start building a good support system from their family, from their friends. They should try to get a good mentor who can help them. And then they have to have built up their own confidence. Okay, so they have to build their own confidence. So they have to give really good efforts to build up their own confidence in terms of academics, in terms of social life. That's key. There should not be any room for the self-doubt, because these are the students who are really very bright students, and they have done so far very well. So I always feel they should be doing well. Why not? So most of the time, the problem what they always doubt about themselves is not real. It's just what is made by their minds. So they have to uh, get out of it and start moving, giving hard work, and they will achieve their goals. That's what I feel. And most importantly, they should master the time management. And I always tell most of the students, they should not keep many high end goals. They should keep like two short term goals or three short term goals. And out of that, one goal should be easy, so that they don't feel like depressed. So they should keep like three or two short-term goals, and out of which one should be like easier one. And that's how they should try to cope up with the changing scenario around them, and that's how they can cope up. But I personally feel the family support is very important. The friends, what they choose, it's very important. And apart from that, the mentoring, what they pick up at this time, is going to be crucial for their journey.
Dr. Shabadi, now that you have discussed about the challenges that medical students face in the first years, how about when it comes to the clinical rotations where the medical students go into their second year, third year, and so on? What challenges do they face?
So, Ringer, I feel when the medical students start going to the clinical rotations, the scenario change, because in the first year and even like till like mid second year, they are by themselves. I mean, they are studying by themselves. They are like most of the loners. They are happy with that. They are studying and they are writing exams and they're fine. But what happens from the clinical rotations? They have to go and interact with the patient. So they will be into a small team or group of people. They will go and attend the clinics, right? And they will go and interact with the patient. So most of the students here, they will start struggling, because not all of them, they are really geared up to adjust to the social circumstances or the social etiquettes or the socialization, what we see in normal terminology, how to deal with the patient, how to talk to the patient, how to really be empathetic to the patient, and how to be nice to the patient, so that you can really develop a doctor-patient relationship. And they start struggling and they start losing their confidence. And obviously, over a period of time, with practice and observing around, they will pick up. But that initial phase is going to be like a little bit stressful, where they really don't know how to approach a patient, right? That's what I feel. And as I said, slowly they will be working in small groups, so that team interaction, some people find difficult, right? And then once they are into clinical rotations, they are longer periods, because I mean, your history taking maybe taking a long time. You have been given some tasks to finish, you have been given some clinical work to finish, and they are going to be like longer working hours. And then they start feeling exhausted. They find difficult to have a work-life balance, because many students start losing their or sacrificing their time for exercises or stress buster program, and they start feeling like work-life balance. And then slowly the talks about your residency program, post-graduation, and further your what you want to pursue in your life, post-graduation, all those talks are, and then they start feeling like academic pressure to get good scores and to prove themselves, and they start feeling like burnout. And at the same time, there will be always uncertainty of the future, because your peers will start talking about how that specialty is changing, how that specialty is not doing well, and then you feel uncertainty about your future. So these are the major problems what they feel. And again, sometimes they will lose motivation because of all these major problems. They will start losing motivation. And here the major thing, what I feel, they will not, if they don't have a good mentorship, they really start even struggling more. And that's what I feel during this second year and third year, when they start getting into clinical rotations. They really need a good mentorship, a person who can be with them, who can guide them. And then this is a very good time. Actually, second year and third year is a very good time. When they have clinical rotations, actually they can find out which specialty they're really passionate about. And if we lose this time, then it becomes very difficult once you are already there to pursue your career for the post graduation. And many students, they feel, I really don't know which specialty I want to pursue, or they may have the on effect. That means they will just like one trait of some specialty and they want to go behind it, but they don't evaluate it themselves how that specialty will treat him or her. So these are the problems what they face.
Thank you for highlighting the importance of proactive communication and hands-on learning for medical students during their clinical rotations. Definitely encouraging them to seek opportunities to actively engage with the patients and their clinical team can be of very great significance in their learning experience. Now, moving on to our next question, Dr. Shabadi, how does workload affect medical students' mental health in the early years? And what help is available for stress and burnout?
So, Nigar, not only early years, but throughout their career, most of the medical students and medical professionals, they feel burnout. Because the burnout is not only from working long many hours, but it comes out from various factors. First of all, your kind of work, what you are doing, how many hours you are working, are you getting adequate sleep, are you emotionally stable, are you getting any emotional support system you have or not. And then apart from that, are you enjoying your work? So these are the major things that will definitely contribute to the burnout. And as you know, our medical professional or medical studies, they are really demanding. We have to really work long many hours and to really crack up those examinations. So I have prepared my USMLE after 15 years of my medical school, and I know how hard it was. I was working the whole day, and in the evening hours, I used to go and study for my USMLE exams. So, and those exams are not very straightforward. Those are like long, many hours. You have to sit at one point, 7 to 8 hours, and you have to write those exams. So, our medical system, they not only test your knowledge, they test your stamina, endurance, and grit. So, all of us have to gear up for all those kind of traits, and we have to develop the values. But as we know, many medical students starts feeling burnout if they don't have really left out the motivation, if they don't have a good mentor or good teachers or educators around them, and if they don't have a good support system, they definitely feel burnout and left alone. And unfortunately, as I know of, there are not really good robust systems which have been developed or being into medical schools, which really take care of the mental health of our medical students or the medical professionals. So I personally believe we should develop a good system which will take care of our medical students, because we have to remember, as medical professionals, we have to remember these young students are going to be the future of our fraternity. So we are morally obliged to support them and take care of them.
Dr. Rahul, I definitely agree with you that the demands of medical school can have a very negative impact on our health, which will lead to stress, anxiety, and eventually to burnout, where you want to give up everything that you're doing. And I believe that as young students, we should not feel ashamed of the feelings that we're going through. We should always seek for help. It could be maybe through your loved ones, or it could be through an expert around you that you can approach, or even sometimes lucky are the ones who have some institutions or some services that are near them that offer counseling or wellness programs and support to these students to manage their mental health effectively.
Absolutely, Nigar. I can definitely understand the major stress what the medical students go through. I do agree.
Now, coming to our final question of the day, How can educators help medical students transition smoothly from studying to patient care while staying motivated and well prepared?
So I think the educators or the mentors or the coaches around the medical students during the medical schooling and during the residency program, what they should focus around is, first of all, they should think about not only academic growth of that student, but the holistic growth of that student. It's not only just focusing on their education, their research, and then we are not worrying about their mental health, which is not a fair game. So we should be focused more on supporting these medical students and taking their care, especially of the mental health. We should set their goals, which should be realistic, and then we should teach them the time management. I mean, most of the students, I tell them we should follow the Moscow rule, that we should divide our priorities into 4 groups. First is mostly I will do it, that is MO. Then second group comes as a should, I should do this. Third comes I could do this. And the fourth one, I won't do this. So this is called as Moscow rule. So we should divide our tasks into 4 things, 4 groups, and we should prioritize and we should work on them. And then, as I said, we should not keep short-term goals as very hard, because if we fail on all those, it's very disheartening and depressing. So we should divide our short-term goals like into 3 tough ones, 1 or 2 easier ones, and then we should have short-term goals around like 3 to 5 years, and then long-term goals where we want to see after like 5 to 10 years. We should have that vision, and it's very important the mentors should help them to see their career into a bigger horizon, not only into academic, what that student is capable of, and that what that student really want to. And most important thing, what the mentor or the teacher can do is he should or she should evaluate that student, and they should be very honest to tell that student which specialty he or she should opt for. Because it's not like you like something and you just go behind it, because when you choose the specialty, you are going to stay with that specialty for rest of your life, almost like next 30 years. And if something goes wrong, like you just choose that one specialty because you like it, but your personality is slightly different, or there is a mismatch, and that's the problem where most of the physicians will start feeling the burnout, because there is a mismatch between the specialty demand and what a physician can deliver. Okay, and that's how the self-evaluation and the evaluation by the teachers is very important.
Dr. Shabadi, your expertise today on our platform is definitely a guiding light to our medical students and junior doctors who are navigating through this maze of challenges in their educational journey. Thank you so much for embracing on this important topic with such passion and dedication.
Thank you so much, Dr. Nagar and MedSynapse, for giving this opportunity on this wonderful topic, which is not being often talked about, but it's need of the time that we should really start talking about the mental health and burnout in the medical students and the physicians, and we should be helping them wholeheartedly. Thank you so much for taking this initiative.
Thank you so much, Dr. Shabadi, once again, and we're looking
You're
forward
welcome.
to
Thank
having
you.
many more sessions together.
Thank you. Take care. Bye-bye.
And to our audience, thank you so much for tuning in. Your support and engagement makes these discussions meaningful and enriching. Until next time, goodbye.